So the objectives of this session are as follows. So I'm going to introduce the lower limb. After that, I'll talk about the bony pelvis and the proximal femur. I'll talk about the saphenous opening and what structure passes through it. I'll talk about the femoral triangle, the boundaries, and the contents. And I'll also talk about femoral hernia a bit here. And I'm going to talk about the anterior compartment muscles of the thigh. Then lastly, I'll talk about the medial compartment, anterior compartment muscles of the thigh and medial compartment muscles of the thigh as well. Then there's homework, which you need to work out. Okay. So when it comes to the lower limb basically like starts at the region of the pelvic region there. So you have the pelvic bones there. Then going down in short, that's the lower limb, right? From the pelvic region going down. Okay. So the lower limb is basically specialized for transmitting the body weight and locomotion. Okay. So you will find a lot of big things in the lower limb. That's why you will find the strongest bone. So the femur is the strongest bone in the human body. So the biggest sesamoid bone is the patella. So the patella is a sesamoid bone. On the hand, you have the pisiform bone. Okay. That's why you will find the biggest nerve, the sciatic nerve. Okay. So when it comes to the lower limb, basically, it has 6 parts. So you have the gluteal region, you have the thigh, which is divided into the anterior compartment, medial compartment, and posterior compartment. You have the knee. So that's where you talk about the knee joint and the ligaments that are involved in the formation of the knee joint. Then the leg, where you have 2 bones, you have the tibia, the second largest or the second strongest bone. Then on the lateral aspect, you have the fibula there. Then there you have tarsal bones. You have 7 tarsal bones. On the hand, you have 8 carpal bones, but for the leg, you have 7 tarsal bones. Then you talk about now the foot. Okay. So basically, that's the lower limb itself. So the pelvic region, the thigh, the knee, the leg, the ankle, and the foot. So let's begin with the hip bone. So when it comes to the hip bone is made up of 3 bones. So you have the ilium, which is this bone here. You have the ilium. You have the pubis, which is anterior. And you have the ischium, which is posterior and inferior. So these 3 bones, they unite, and when they unite, they form a cavity there. So that cavity is known as the acetabulum. So the acetabulum is formed by these 3 bones. So the ilium is going to form the upper 2/5 of the acetabulum. The pubic bone is going to form the anterior 1/5 of the acetabulum, and the ischium is going to form the posterior 2/5 of the acetabulum. So these 3, they unite to form the acetabulum. Then you have the obturator foramen there, formed basically by 2 bones, the pubic bone and the ischium there. Okay, so these 3 bones are the ones that will make up the hip bone. And a human being has 2 hip bones, the right and the left hip bone. So when you look at the acetabulum is located on the lateral aspect, and this part articulates with the head of the femur to form the hip joint. Okay. So let's begin with the ilium. So when it comes to the ilium, like it is the bone that projects from the acetabulum upwards. Okay, so the ilium has two ends. You have the upper end and you have the lower end. So if I can draw, so this is the upper end of the ilium.
Power off.
And that's the lower end of the ilium. So the ilium has two ends. You have the upper end and the lower end. The lower end is small and it is the one that will form part of the acetabulum. So it's going to form 2/5 of the acetabulum. Okay, while the pubic is forming 1/5. And the ischium forming the lower 2/5 of the acetabulum. Okay, so the lower end of the ilium and the upper end. The upper end of the ilium is going to form the iliac crest. So that part you can see there, if I can change the color. So the upper end is going to form the iliac crest. So this is the iliac crest. Okay. Then when you look at the ilium, it has three borders. Okay. So the ilium has three borders. So what are those borders for the ilium? So you have the anterior border, which is basically this one. So this is the anterior border of the ilium. So it begins from the anterior superior iliac spine there. So the anterior superior iliac spine is just the anterior projection of the iliac crest. Then at the back there, you're going to have the posterior superior iliac spine. That is just a posterior projection of the iliac crest. So the anterior border is going to begin from the anterior superior iliac spine and it ends at the acetabulum. So this is the anterior border. Then you have the posterior border of the ilium. So when it comes to the posterior border of the ilium, it begins from the posterior superior iliac spine, goes all the way down to the acetabulum. So that is the posterior border of the ilium. Just a minute, we can pause the video. So for the ilium, like I said, it has three borders. The anterior border, which you've already seen, from the anterior superior iliac spine to the acetabulum. Then the posterior border is from the posterior superior iliac spine all the way as well to the acetabulum. Okay. Or in short, you can say the posterior superior iliac spine is continuous with the posterior border of the ischium. So this is the ischium, and that's the posterior border of the ischium. When you look at it, the posterior border of the ischium is continuous with the posterior border of the ilium. Then lastly, you have the medial border. So the medial border is this border here. Okay. So the medial border starts from the iliac crest, because this is the iliac crest. So the medial border starts from the iliac crest to the iliopubic eminence. So what will happen is that this medial border of the what? So this is the medial border from the iliac crest to the iliopubic eminence. So the lower part of the medial border, this lower part of the medial border. So the lower part of the medial border, this lower part of the medial border is also known as the arcuate line. Okay. So the arcuate line is just the lower part of the medial border of the arcuate line is just the lower part of the medial border of the ilium. Okay. Then when it comes to the surfaces, the ilium has three surfaces. So we put a pointer. So you have the gluteal surface, which is basically, let me go here. So the ilium has three surfaces, right? So you have the gluteal surface, which is that surface there. So when it comes to the gluteal surface of the ilium, it is convex anteriorly and concave posteriorly. So it runs like that. So convex, then concave posteriorly. So on the gluteal surface of the ilium, there are 3 lines which you need to know. You have the posterior gluteal line, which is that one. We draw. So you have the posterior gluteal line, which is that one, that line there. That's the posterior gluteal line. So the posterior gluteal line starts from the iliac crest, as you can see, like 5 centimeters from the posterior superior iliac spine. Then it goes all the way to the posterior superior iliac spine. Okay. Then after the posterior gluteal line, you have the anterior gluteal line, which is this line, the longest line. So that line there is the anterior gluteal line. So the anterior gluteal line comes from the greater sciatic notch. So this is the greater sciatic notch. And that part there is the lesser sciatic notch. So the anterior gluteal line comes from the greater sciatic notch, then it goes all the way to the iliac crest. Then lastly, you have the inferior gluteal line. So the inferior gluteal line is that line there, this line down there. So the inferior gluteal line starts from the anterior inferior iliac spine and it goes all the way to the greater sciatic notch. So these 3 lines are found on the gluteal surface and they serve as attachment points for muscles, the gluteal muscles. So there's the gluteus maximus, the gluteus medius, and the gluteus minimus. So for the iliac fossa, that's the second surface because we said the ilium has 3 surfaces: a gluteal surface, the iliac fossa. So the iliac fossa is just that part there. Okay. So the iliac fossa is bounded superiorly by the iliac crest, as you can see. Then you're going to have that part there of the anterior border of the ilium. Then posteriorly, it's bounded by the medial border of the ilium.
So,
Hello?
I'm sorry. Can you just mention the 3 lines of the gluteal surface?
So the 3 lines. The first one, you can see that line there, right?
Yes.
That's the first line. It is known as the posterior gluteal line. That's where you've heard of the gluteus maximus, right?
Yes.
So the gluteus maximus will insert on the posterior gluteal line, somewhere there. And that part, that's where the gluteus maximus will insert. So you have the posterior gluteal line, then you have that line there, which is coming from the iliac crest. It's going like that, going down until it reaches the greater sciatic notch. So that one is the anterior gluteal line. Then the last line is this one here, which is inferior, this line there, down there. Okay. So that line is the inferior gluteal line coming from the anterior inferior iliac spine to the greater sciatic notch as well.
Okay, okay, sir. Yes.
Okay. So for the iliac fossa, the boundaries, you know them: superiorly by the iliac crest, anteriorly by the anterior border, and medially you have the medial border, basically. So this is the medial border. Okay, so that's the iliac fossa. And you'll find a muscle there in the iliac fossa known as the iliacus muscle. We'll talk about it. Then you have that opening in the iliac fossa. So that opening is known as the nutrient foramen. And the nutrient foramen will just transmit the nutrient artery, and it's going to supply blood basically to the ilium. And that nutrient artery is a branch from the iliolumbar artery. And part of your homework is to look at the arteries of the lower limb. So you need to know where this artery is coming from, the iliolumbar artery. Then the last surface is the sacro-pelvic surface. So the sacro-pelvic surface is just that part. Just by the name itself, it has two parts. So you have the sacral part, which is that part, and you have the pelvic part. So when it comes to the sacral part as well, the sacral part is going to have two parts. You have the iliac tuberosity, that part there, and you have the auricular part. When you look at that part down there, it has the shape of an ear. Hence, no wonder they gave it the name auricular part. Some books, they'll call it horseshoe part, because again, it also looks like the foot of the horse. Okay? Then you have the pelvic part. The pelvic part is that smooth part inferior to the sacral part. So the sacral part, just by the name itself, it is the one that is in contact with the sacrum. And the pelvic part, it's part of the pelvis. It is continuous with the ischium. As you can see down there, you have the ischium. So the ischium, you have the pubic bone and the ilium there. So when it comes to the pubis is the most anterior bone of the pelvic girdle. So you have two bones. So you have that one and you have that one. Okay. So pubic bone has three parts. You have the body of the pubis, which is that part, and the body of the pubis is in contact with the other body of the pubis. They make that joint there, known as the pubic symphysis. And you have cartilage there that joins the two bones, and the type of cartilage is hyaline cartilage. Okay. So then you have the superior ramus of the pubis, and you have the inferior ramus of the pubis. Given that side, you're going to have the superior ramus of the pubis, you're going to have the inferior ramus of the pubis. Okay. Then when you look at on the body of the pubis there, you have a projection. So that projection on the body of the pubis is known as the pubic tubercle. Then on top of the pubic tubercle, more like a ridge, you have a ridge which is a bit visible on this diagram. So that ridge is known as the pubic crest. So the ridge is known as the pubic crest. Then the projection on the body of the pubis is known as the pubic tubercle. Then when you go posterior to the pubic tubercle, so the pubic tubercle is somewhere there. Posterior to the pubic tubercle, you have that line there. Okay, so that line is known as the pectineal line of the pubis. Okay, it is just posterior to the pubic tubercle. So that's the pectineal line of the pubis. Then you have another line on the anterior aspect that will participate in the formation of the obturator foramen. So that is the obturator foramen. Then you have that part of the pubis that is participating in the formation of the obturator foramen. So that part is known as the obturator crest. Okay. When you look at the pectineal line is continuous with the arcuate line. The arcuate line, like I said, is just the lower part of the medial border of the ilium. Okay. Then the ischium, the last bone. So the ischium is more posterior, and it will form 2/5 of the acetabulum. So when it comes to the ischium has a tuberosity. That's where you basically sit. So that tuberosity on the ischium is known as the ischiotuberosity. Then you're going to have the lesser ischial notch and the lesser sciatic notch, and you're going to have the greater sciatic notch. Then in between the two notches, you have that spine known as the ischiospine. Okay, so that's all about the ischium, and this video is going to end soon. I only have 1 minute, so you need to rejoin again. So basically, you have those two hip bones. You have one that side, the other on that side. The hip bones, they articulate with the sacrum. Okay, and the sacrum down there, you have the coccyx of it's part of the bone, the pelvic bone. Then the two pubic bones, they form a joint known as the pubic symphysis. Okay, and you have the obturator foramen there. So that's basically bony pelvis. made up of 2 hip bones, the sacrum and the coccyx. So rejoin again. This video is ending.